الكلمة دلوقتي مع دكتورة سارة عبد المقصود، وهي رئيس وحدة الأشعة المتخصصة بالإدارة العامة للأشعة بوزارة الصحة.
مساء الخير. عارفين ان اليوم بيطول عليكم، بس ان شاء الله السيشن دي يبقى يعني هنستفيد بيها مع بعض. طبعا بعد محاضرة الدكتورة سام هيبقى صعب ان انا اخش اقول حاجة، بس hopefully ان شاء الله تعدي معانا. First, I'd like to introduce myself. My name is Dr. Sara Fawzi Abdel Maqsood. I'm a proud member of the General Department of Radiology. This brief presentation that we are about to see is to explain how the GDR handles the different requests received from the hospitals regarding requests for new equipment. We have to be able to justify the needs of the hospital and to see in an objective and a non-subjective manner whether this hospital deserves or is eligible to receive this requested equipment or not. And so to be able to approve or deny this request, we needed to have a documented methodology that would support the decision of the GDR. So to be able to do that, GDR has developed a document. It's called Certificate of Needs, or the CON. The CON is basically a scoring system that is done for the different aspects present within the hospital. These aspects, they accumulate together a score. According to that score, we have a prioritization method to put these hospitals into categories. First or highest category is the one that would receive the requested equipment, and the least in the prioritization matrix is the one that should not be receiving this equipment or would receive it but later, not at the time of the request itself. So now I'm gonna share with you an example, and this is a case study for the MRI. What does the GDR do, or what would it do and request from the hospital when receiving a request asking for an MRI machine? And this is just to allow you to visualize how this works. This is the certificate of needs for the MRI. The first thing, it's divided into 4 sections. First one is for the standard present. The second one is for the elements for each standard, and then the points that are going to be rated, and then the score. The type of hospital itself is one of the important standards. Whether it's an oncology center, it's a specialized hospital or center of excellence, if this is a hospital that is a teaching one or an institute, a therapeutic institute, or a medical insurance hospital, general hospital, or central hospital. The highest score is given to the oncology center because of the nature of the services that are given to the patients. Because the MRI machine here would be maximally utilized. Versus the central hospital, we might have this MRI machine where it's not used as it should be. Again, an MRI machine is an expensive investment. It should not be placed in a place that's not going to fully utilize all of the options and all of the exams and offer the full capacity of service. The second item would be the place of the MRI, or the MRI unit itself. Where is it present in the hospital? How big is it? When we say dedicated unit should not be less than 50 meters square, because this is the minimum requirement for an MRI unit to be established or initiated. And the space here itself is considered important, not just because of the dedicated square footage or square meter in that case. It's because there are certain items should be present in the MRI unit that would use all of this space. The MRI cage itself has to be big enough to accommodate for the machine. And then there's a space for the chiller, and there's a space for the control room, and then a space for the patient changing cubicles, a waiting area, dedicated bathrooms. And finally, as Dr. Siham was referring in her presentation, NIS 22, which is dedicated for the radiation safety and MRI safety. Now, the MRI unit should be, according to the standards or any quality standards, it has to be divided into zones, 4 zones. 1 being the most safe for the patient to be present, and the 4th is the magnet itself, which is the magnetic field or the exam room. The patient is not allowed to move from the 1st zone to the 4th zone to receive the exam unless they were scanned for safety items to make sure that the patient is safe to enter the exam room. A patient could have a pacemaker, he could have any sort of implants or artificial part which is not allowed, does not allow him to enter the exam room. Then, after saying all that about the space, the second thing about the unit of the MRI is the floor dedicated for this unit. It's better to have it in a ground or a basement floor because having an MRI, it's a heavy machine, requires consolidation or what we call tad'im under the machine itself to be able to support the machine. If there's a related department for a relation to the radiology department or the emergency room, I have to be able to be near so that the machine is easier to be used, speaking of the hospital workflow itself. The unit design here, we mean it should be patient-friendly or patient workflow friendly. It has to be able to accommodate for an easy workflow for the patient. And then the surroundings to the dedicated MRI unit. To have an MRI machine, there are certain prerequisites that should be present, like not having nearby electrical cables or electrical field. Another example for the importance of the surroundings to the MRI unit, there was this radiology center that wanted to install an MRI, but they couldn't because there was a nearby metro station that produced vibrations. And these vibrations affected the quality of the image of the MRI, and they were not able to install this machine. Reporting system, of course, we have to have an available radiology consultant with an MD. However, now he does not have to be present in person. We can always revert to teleradiology. However, he should have an MD, just to assure the quality of the report that he's going to be reporting. Available specialties must be present to be able to fully utilize the machine. Neurology, neurosurgery, orthopedics, oncology, because it really wouldn't make sense to have such a great investment and then not be able to use this machine. The running costs. Well, now I install an MRI and it's working fine, but the hospital does not have resources to pay for its maintenance. So with the first problem, the MRI stops. Millions of Egyptian pounds or even dollars are paid, but the machine stops because the hospital cannot afford a few thousands to be able to maintain the machine and have it running all the time. If there is an available service that is available within 20 kilometers in distance near the hospital, it's not worth it to have an MRI machine installed in such hospital. It would be much cheaper to just pay for the patient's transport from point A to point B or to another hospital that has the same machine within 20 kilometers. Well, having explaining all these standards that we use for evaluating whether the hospital should have the machine or not, there's always a question. Are these the only measures, or are there other special considerations that would be considered and would allow a hospital to have a machine without going through this certificate of needs? There are always exceptions. There are always other special considerations. And some of these considerations, are meant to be a criteria of their own. They can have the hospital have the machine without even being evaluated with this certificate of need. Like hospitals with special nature, border hospitals between countries. These are considered to be a high priority to be supplied with equipment, even if their score is not high enough to have it supplied just like the regular hospitals. The remote hospitals, if there's a hospital that's remote enough without having services within the catchment area, this would justify supplying the hospital with this equipment. There are other hospitals with special importance because of their location. They're not regularly, they're not border hospitals, they're not remote hospitals, but they're placed in a strategic place. For instance, a hospital in Siwa Oasis. It's not a border hospital, it's a bit of a remote hospital, but you might find other hospitals nearby. However, there's always tourism there, a lot of tourists, a lot of people going, and it's like we say bustling and hustling with a lot of people. That would justify this hospital to have this equipment. The strategic view of the MOHP. Some areas that we might see as areas are not that important right now, or the hospitals in such areas do not score a high enough score to have the equipment. However, there's always a strategic view to the MRI as the area where the hospital is placed could be going development soon, or could have some sort of importance that we wouldn't know about now. So this is enough to supply the area with whatever type of machine required. And then there's always the technical view of the GDR. I mean, we can supply the hospitals if we see needs this or would need this equipment in the near future. These were the points I wanted to elaborate in this brief presentation. And I thank you all for your time and attention. If there are any questions, you're more than welcome. Thank you.